Hello, Professor Meek. My name is Vera Clark, and today I'm going to be discussing renal calculi. So, what is renal calculi? Renal calculi is the formation of calculi, which is also known as stones, that form in the urinary tract. Typically, these calculi can form in the kidneys, but also they can form in the ureters and the bladder. So, if a patient has the formation of calculi in the ureters, this is known as urolithiasis. If these calculi form in the kidneys, this is nephrolithiasis. And cystolithiasis is where these calculi form in the bladder. So, how are these calculi caused? There's a variety of reasons that calculi can form in the urinary tract. So, one of the first causes could be family history or a genetic predisposition, chronic dehydration, the use of ongoing diuretic medication. People who are immobile, whether they are bedridden or wheelchair bound, can also experience the formation of calculi. Chronic urinary tract infections, long-term catheterization can cause these, and diets high in calcium, vitamin D, protein, oxalates, purines, and alkalis can cause the formation of these as well. Hypercalcemia and hyperparathyroidism can also be a factor in the formation of calculi in the urinary tract. So some of the signs and symptoms that a nurse would find during an assessment would be severe intermittent pain that has a sudden onset. Also a dull aching pain in the kidney area. Renal colic or radiating pain that comes from the kidney area down to the lower abdominal area. Nausea, vomiting, sweating during acute episodes of pain. Symptoms of urinary tract infection, where it would be like alternating urinary frequency with urinary retention, painful urination, feelings of urgency to empty the bladder, but upon voiding, only a little bit comes out, blood in the urine, low-grade fever, pallor, are also indications that there could be something going on in the urinary tract system. Labs and diagnostics are used to diagnose this. First, urinary analysis would be done. Oftentimes, they're going to indicate white blood cells in the urine, hematuria, which is blood in the urine, which would also have red blood cells in the urine, increased uric acid. Blood work would show increased white blood cells count if there is an infection of the urinary tract system. Also, CT scans are used as well as ultrasound. They would have evidence of calculi that are presenting during those examinations. And also, cystoscopy is performed where a camera is actually entered into the bladder and the bladder is examined via a small camera where there could be the presence of stones there. There's a variety of treatment for this condition. Sometimes a catheter will be placed just past the stones to help empty the bladder and also to dilate the ureters. Sometimes chemical irrigation can be used to dissolve the stones. Sometimes a non-invasive mechanical procedure called extracorporeal shockwave lithotripsy can be used to help break up the stones. Sometimes a stent can be entered into the urinary tract to help the stones pass on their own. Sometimes ultrasonic waves are directed to the stones to help break them up and allow for them to pass on their own. In worst case, sometimes invasive surgery is needed where the surgery is indicated to remove the stone. Placement of a permanent catheter is done. Sometimes a removal of a kidney or a partial kidney removal is indicated. As a nurse, the nursing intervention that would take place would be diet modification to reduce the intake of calculi-causing foods. We would ensure that the patient is getting a good amount of oral fluid intake, up to 3,000 milliliters per day. If the patient is not able to tolerate oral fluid intake or it's contraindicated, we would give IV fluids. We would monitor for signs of infection. We would administer medication and also monitor and assess pain. We would reposition a patient who is immobile or bedridden to help encourage the stone to pass on its own, promotion of the passing of the stone. We would encourage ambulation for patients who are able to ambulate. We would monitor the catheters and the drainage apparatus that would be used. We would, of course, monitor vital signs, watch for changes in the heart rate or blood pressure, which could indicate blood loss. If a patient were to receive surgery for this condition, we would do post-operative care. So we would monitor for signs of bleeding or hemorrhaging, monitor input and output, monitor the urine flow of a catheter that's been placed, monitor for adrenal insufficiency, maintain a position of the patient in a semi-Fowler position, and we would also monitor incisions and do frequent incision care, changing the sterile dressings and whatnot. In terms of patient education, we would indicate to the patient that hydration is very important to prevent the formation of stones. It's important to remain properly hydrated, with recommendations drinking 1 ounce of water per pound of body weight daily. We would discuss signs of infection to look out for, which would be redness, swelling, or pus of the incision site. Any drainage of the incision site is something that needs to be watched out for as well. Systemic signs of infection such as fever, chills, lethargy, or general malaise. We would educate the patient on signs and symptoms of urinary obstruction, hemorrhaging, and we would also teach the patient how to care for their surgical incision. So proper cleaning and dressing change. One of the most important things that we would educate the patient on is diet modification to limit the foods that cause calculi formation. Purines, the foods that need to be avoided are fine bone fish such as sardines and herring, mussels, liver, certain meat such as venison, as well as some sweetbread should be avoided or limited. Calcium. So high amounts of calcium found in dairy, beans, again, fine bone fish, dried fruit, nuts, as well as chocolate and cocoa should be avoided or limited. Oxalates. Patients should be educated that dark roughage, for example, spinach, asparagus, cabbage, should be avoided or limited to small amounts, as well as tomatoes, chocolate, cocoa, and tea. These diet modifications should help prevent the formation of calculi, and proper hydration, of course, should help prevent them as well. Again, there is potentially a genetic predisposition to this condition, so patients could potentially develop this condition despite the interventions that they've introduced into their life and lifestyle choices in terms of diet. And that is my presentation for today on renal calculi. Thank you.